Intermittent fasting is a dietary pattern that involves alternating periods of fasting and eating. There are several different types of intermittent fasting, but the most common ones are the 16/8 method, the 5-2 diet, and alternate day fasting. 16/8 intermittent fasting, also known as the 16-8 diet, is a type of time-restricted eating where you fast for 16 hours and eat during an 8-hour window. During the 16-hour fast, you're allowed to drink water, coffee, and other non-caloric beverages. Then, during the 8-hour eating window, you can consume your meals and snacks as usual. For example, if your eating window is from 12 p.m. to 8 p.m., you would fast from 8 p.m. until 12 p.m. the next day. This means you would skip breakfast and have your first meal at noon. This type of intermittent fasting has become popular because it's relatively easy to follow and fits into most people's lifestyles. It can also be beneficial for weight loss, improving insulin sensitivity, and reducing inflammation. 5-2 intermittent fasting, also known as the fast diet, involves eating normally for 5 days of the week and restricting calorie intake to 500 to 600 calories for the other 2 non-consecutive days. During the fasting days, you're allowed to eat small meals or snacks that add up to no more than 500 to 600 calories total for the day. On the other 5 days of the week, you can eat normally and do not have to restrict your calorie intake. For example, you might choose to fast on Mondays and Thursdays, and eat normally for the rest of the week. During your fasting days, you might have a small breakfast and lunch, and then a small dinner in the evening. Here are some potential benefits of intermittent fasting. 1. Weight loss. Intermittent fasting can help you lose weight by reducing your calorie intake and increasing your metabolism. It has been shown to be an effective tool for weight loss in several studies. 2. Improved insulin sensitivity. It can improve insulin sensitivity, which can reduce the risk of developing type 2 diabetes. 3. Lower inflammation. Intermittent fasting may help reduce inflammation in the body, which is linked to several chronic diseases. 4. Improved brain function. Some studies suggest that intermittent fasting can improve cognitive function and brain health. 5. Longevity. Animal studies suggest that intermittent fasting may increase lifespan and delay the onset of age-related diseases. It's worth noting that intermittent fasting is not suitable for everyone, especially those with certain medical conditions or those who are pregnant or breastfeeding. If you're interested in trying intermittent fasting, it's always best to talk to your doctor or a registered dietitian to make sure it's safe for you.